My name's George from Vivid Care, Sales Director, and I'm just going to run through the Levara Rise and Recline chair. This is typically used in the hospital environment where patients need assistance from sit to stand, so they may have a rise and recline chair at home, or if they need the comfort and support where the leg rest comes up and the backrest goes back. So that's what I'm going to show you first of all, is the movements of this chair, the different positions that we can place it in. So the top two buttons on the handset are for the backrest. So if somebody can't tolerate sitting in an upright position, we can drop the backrest angle back to support them. But the main function is these two buttons here down below. So on the left hand side we have what we call the tilt in space mechanism. So that is where the leg rest is coming up, the backrest is dropping back slightly, but we're achieving a really good tilt from the front of the seat down to the back, so it prevents a patient sliding out and down the chair. So in this position here we've got some good comfort and pressure relief built into the seat. All this material through the middle is upholstered in something called Dartex, which is your four-way stretch breathable material, so you get a lot better immersion into the chair. But you've also got pressure relieving foam, so a medium to high risk visco foam wrap with a reflection foam cushion underneath the seat. So this is showing it in its recline position. If we press the bottom right button, this brings the chair back to its standard position. So the footrest tucks away. And then this is where it helps the patient into a stand. Now this particular rise on this chair has a little bit of vertical rise first before tilting forward, which is important that if you get patients who are struggling to mobilise and they've got a lot of pressure on their knees, this makes it difficult to rise. So with having the vertical and the tilt, it makes it a lot easier to take it to a sit to stand. So you'll see that you've got 4 braked casters, dual casters on here. So if we want to take the patient out onto a patio area or down to the gym or around the wards, we have a push handle at the back where we can really easily manoeuvre the patient in the chair and take them to where we need to be. This push handle is adjustable in height, so depending on the height of the carer, we can set that to the right height. Your backrest is made up of 3 cushions, typically called waterfall cushions, and these are all held on by magnet. So no longer do you have the issue with keeping the Velcro clean. You've got a nice smooth white cleanable area to clean it in between patients, and the same goes for the wrap, which is called a seat and leg rest wrap, and the cushion below, they also remove by Velcro. So it means you can also reposition the cushions in any format. You might want to have a T position for somebody with spinal issues, so something more like that, or typically in the standard waterfall cushion, which is like so. So nice soft padding to the cushions to give patient the comfort there. Your handset is also magnetic, so we can attach that to the front of the chair, either arm, or to the back on the push handle if we want it away from the patient. So as regards the warranty of the chair, you have 5 years on the frame itself and then 12 months on the upholstery. Another feature of this chair is how easy it is to use with moving and handling aids such as the Sarah Steady. So whereas with other rise and recline chairs you have a big thick arm with a little caster at the bottom, when it comes to using it with those devices, however wide you open the legs, you can't get the Steady anywhere near, which means the patient's bottom is at the front of the chair. Before we know it, we've got more of a sacral sit. So just to show you with the Steady, if we open up to its widest position, you'll see that we can get nice and near. We've got no conflict with the arms here because they're set back and set down, so you can quite easily get the paddles in place and the patient nice and near to the front of the chair there. So on this chair there's a few optional extra accessories. This backrest, as you see, has got the waterfall cushion. We can remove one of these cushions and replace it with a lateral shape cushion. So this is somebody who tends to lean more heavily to one side and needs more support, either in the hip area or, as I've shown it here, the mid-back, or even if somebody needs more head support. The other addition is that this is a medium to high risk pressure relief, so a visco foam wrap with a reflection foam cushion below. We can remove this area here and replace it with a gel. So this is a high risk gel, a cool gel, and as well as having a cooling effect, it also distributes the pressure more evenly and gives the patient more comfort. So we can take this, we can upgrade this chair from medium to a high risk pressure relief. This chair is fixed in size in terms of the width and depth of the chair, which is typically suitable for anybody around 5'7". However, if you have patients who are smaller or taller than that, we supply the Lento range of chairs, which are all adjustable in seat width, so the arms move in and out, depth of seat, so we can reduce or extend the depth, and the armrest height we can increase or decrease. The armrest on the Lento range of chairs also removes all the way off, so if a patient's doing a lateral transfer. So those are some areas where this chair may not be suitable and you may want to consider the Lento. So thanks very much for watching. If there's more details you'd like on this chair or any questions you've got unanswered, please feel free to get in touch with the details you'll see below, and we'll look forward to hearing from you.